There are two main types of hysterectomies. There's a total hysterectomy, where the entire uterus is removed, and there's a subtotal hysterectomy, where the uterus is removed but the cervix remains in place. The key thing to keep in mind is that the ovaries typically are not removed if we are simply talking about a hysterectomy.
Okay.
The first thing that a woman should ask prior to proceeding with a surgical procedure in the form of a hysterectomy is, number one, is there any other management that she can utilize to address whatever issues she's having? Is there any medical management that can be employed? She also needs to ask what approach is going to be best for her hysterectomy, whether that's a vaginal approach, abdominal approach, laparoscopic. And then number three, she needs to ask what the benefit or risk would be of removing her ovaries at the time of her hysterectomy. There are several risks with hysterectomy. It is a very common procedure and we do it frequently. However, it is still a major surgery and we need to keep that in mind. So there is risk of injuring things around the uterus, like the bowel or the bladder. There's also big blood vessels that feed the uterus, and there is concern for injuring those vessels. There is also risk for infection, and these are all things that we need to keep in mind before going to the operating room.
Okay.
So after a hysterectomy, the postoperative course is very different for every woman, and when we do a hysterectomy through a minimally invasive approach, whether that's vaginally, laparoscopically, or with the assistance of our robotic technology, the recovery time is very fast. Most of our patients do go back to work after about 2 weeks, but are feeling like themselves generally 2 or 3 days after surgery. The biggest reason that they don't go back to work for 2 weeks is because they're very fatigued as the body is recovering from the major surgery.
Okay.
If a woman is premenopausal when she has her hysterectomy, if we leave her ovaries in place, she will not go into menopause. The hormones will remain the exact same. She will still have ovulation. She will still have the normal fluctuations in her hormones with her cycle. She simply will not have the bleeding accompanying it. However, if her ovaries are removed at the time of the hysterectomy, then yes, if she's premenopausal, she would become menopausal at that point. If a woman is premenopausal and has her ovaries removed and becomes menopausal, then yes, we typically will give hormone replacement therapy for women until the age of natural menopause. Hormone replacement therapy should not be continued for the entirety of a woman's life, but rather until the age when she would normally not have her normal estrogen and progesterone production. The one thing that we also recommend at the time of hysterectomy is removing the fallopian tubes. We've found that the fallopian tubes are often the source for ovarian cancer development, and by removing the fallopian tubes, we can reduce the risk for developing ovarian cancer without affecting a woman's hormones. So we can increase the benefit that a woman will have with the hysterectomy without increasing the risk associated with removing the actual ovaries.